fantastic commitment to bring robust discussions along the sidelines of World Health Assembly, where sometimes the robustness of discussions is varied with a lot of politics and a lot of aspirations. But here is where we'll get to unpack the real grist of what's happening on the ground. I also want to recognize Carolyn and her team for their contributions to GIDH, the Global Initiative on Digital Health, which really now has been working with countries around the world and has 63 members, from private sector to NGOs to implementing organizations, all looking to strengthen how we implement work in digital health on the ground, supporting countries. I just want to pause for a moment and say digital health is at the heart of WHA 78. There are no fewer than 26 official and unofficial side events on digital health and AI. And those are just the ones that we know about. I found out last night that there was a digital health event happening from 8 p.m. to 10 p.m. that unfortunately I just couldn't fit in. But for those of you who are excited about the space and want to contribute to these discussions, there's more than ample opportunity happening. I think in the last 5 years, we've seen really significant progress. And our collective work, your collective work, in contributing to strengthening the evidence of what works, in seeing what doesn't work and trying to figure out why it doesn't work so that we don't repeat, really have contributed to advancing digital transformation. And I think that is the moving out of a state of digital in countries, undertake a cohesive journey of digital transformation based on standards, policy, architecture, and good governance. I do, however, have some sobering news to share, but also this news should inspire us to do better. And that is that in the last 3 months, WHO has had the responsibility of hearing from our member states, at least 41 of them, where data continuity and essential digital health systems have virtually collapsed or catastrophically stopped functioning because of a sudden decrease in overseas assistance. 41 countries. And this means that we are seeing systems that supported clinicians, systems that supported frontline health workers, systems that ensured that HIV patients got the drugs that they needed on time to ensure positive, sustained health outcomes. So I think these critical service and data continuity failures should be for us a wake-up call. Because over the last 10 years, many of you have been part of declarations, commitments to principles for digital development, principles for digital investment. Had we adhered to those principles, I regret to say we would not be in this state that we are in today. So this is a wake-up call for us to improve those best practices, to recommit to those principles, and to call out where we see those principles not being applied, where we see local production not being at the heart of interventions, where we see local capacity and local technology not being strengthened as a pillar of resilience to external shocks. So let's focus on making sure countries have architecture, standards, interoperability in place to be resilient no matter what happens externally to these systems that are not just nice to have. In 2025, increasingly, these are becoming the backbone of health systems globally. We've made a lot of progress, and rather than sit here and for me to tell you the progress we've made, you'll hear a lot about it in the coming few days. Allow me to introduce someone who can speak much more authoritatively on the subject. It's my privilege to introduce WHO's Director General, Tedros Ghebreyesus, who has recorded some remarks for us today. Thank you. challenge you to read his lips.
More inclusivity, more effectively, and better when the systems are designed well, the responses they will for people. Workers are paid on time. People carry their health records with them and access care across borders. And governments can track health spending and make sure it reaches the right place at the right time and has the expected result. These are not future aspirations. Their outcomes we're already seeing in many countries, but they require more than innovation. They require alignment between partners, policies, and priorities. They require strong foundations in governance, infrastructure, financing, and trust. And they require countries to lead their digital health transformation based on national strategies and local systems. That's why the extension and renewal of the global strategy on digital health is so important. It contains actions countries have prioritized for WHO, for partners, and for their own digital transformation. Since 2020, we have made significant progress together. 129 countries have now developed national digital health strategies, and almost 70 countries have assessed their digital maturity through the Global Digital Health Monitor. More than 1,600 government officials have been trained in digital health and artificial intelligence. Through the Global Digital Health Certification Network, more than 1.8 billion people in 82 countries now have secure, portable access to their health records, helping countries develop national digital health architecture and governance frameworks. The WHO Science Council has also focused its work on the responsible use of digital technologies in global health. We're supporting the responsible use of artificial intelligence with guidance on ethics, safety, and regulation. And through smart guidelines and capacity building on open standards, we're enabling countries to build locally owned, interoperable solutions. WHO's role is to advance science, to set clear and trusted standards, and to help countries build systems that are resilient, inclusive, and sustainable. Because the only digital transformation worth pursuing is one that leaves no one behind. Together, we must ensure that the use of digital tools to narrow inequities rather than widen them, that data is collected and used ethically and transparently, and that every tool moves us closer to a world where health is not a luxury for some, but a right for all. I thank you.